A PNP is a pediatric nurse practitioner.
We can diagnose, treat, prescribe, just like a doctor would, but with the touch of a nurse.
Kids A to C with the PNPs. And it's for noses.
Hi everyone, welcome to Kids A to Z with the PNPs.
Where each week we take a closer look at some of the common health problems affecting our kids.
And we are your hosts. I'm Cortney.
And I'm Dominique.
And today, what are we talking about?
Today is the letter N, and we are talking about noses.
Yes, mainly runny noses.
Yes, it's that time of year.
This
is one of the biggest chief complaints in the ER, at doctor's office, nasal congestion and runny nose.
Yes,
So runny nose is a common complaint in a lot of different illnesses, but most often it's seen with an upper respiratory infection or a URI.
Yeah, so most URIs are viral, meaning that they are self-limiting. They get better on their own with time and support and don't necessarily need antibiotics.
Mm-hmm.
Bacterial infections are infections caused by bacteria that usually do need antibiotics to get better. But viruses, your common cold virus, your common viral URI does not need antibiotics and will get better on its own.
So your common cold, which is most often actually caused by, it's called the rhinovirus.
Mm-hmm. Yeah, rhino is actually, I think it's like the Greek root for like nose.
Yep.
I think.
Yeah.
So there you have it.
So as we said, your common cold is a self-limiting that will get better on its own and has to run its course. So some of the symptoms of the common cold are obviously your runny nose, your nasal congestion, your cough, sore throat, low-grade fever, and just overall not feeling good.
Yeah, and again, I know we've said it a few times, but I'm going to say it again. This is a virus. It gets better with time. It does not need antibiotics to get better. But typically, for most viral illnesses, I usually tell parents day 2 to 4, but mainly day 3 is like usually the worst day of illness. And then it tends to get better from there. Although symptoms can last from like 10 to 14 days, and cough can actually last up to like 3 or 4 weeks. Cough is going to be the last thing to go.
So with it can linger for a long time, but with the idea that hopefully after it peaks at day 3 or so, every day should get a little bit better. So kids on average can have up to 8 to 10 colds per year, which is quite a bit. And kids that actually go to daycare are exposed to more germs, other kids at a younger age, and they can actually get more colds per year. So if you're thinking 8 to 10 colds a year, that's almost once a month, once every other month. And if your child's in daycare, even more than that. So it may feel like your child perpetually is always sick, always has a runny nose, when in fact it's most likely just like one virus after the other. They're just keep getting sick.
Yeah. So what can we do to make our kids feel better? What's treatment for runny noses? So they do sell a lot of over-the-counter cough and cold preparations, which we do not actually recommend that you give to your child. These medications typically shouldn't be given in kids under 6. Actually, studies have shown that most of them aren't really effective anyways. It makes parents feel better to feel like they're giving their kids something, but they usually aren't effective and can actually make symptoms worse sometimes.
So what can we do, since we said this was supportive care? You know, we can, like saline drops and nasal suctioning are really helpful, especially in little babies. Infants only are able to breathe through their nose. So when their nose is stuffy or running, it makes sleeping harder, it makes eating harder. Yeah. So I think everyone loves the nose Frida, but even just a simple bulb suction can really help alleviate some of those symptoms. Yeah. Drinking warm fluids for your older children can also help kind of loosen some of those secretions, soothe a sore throat. And the medications, if the fever does occur, you can give the antipyretics or your fever-reducing medications like your Tylenol or Motrin.
Yeah, and another helpful thing just to have in the home is a humidifier. It's important to keep, especially young babies, like you said, their nasal passages clear. Humidified air can actually help kind of thin out those secretions that are plugging the nose and just make them easier to pass through to keep keep their nasal passages open. But a note on humidifiers, they are breeding ground for mold. So if you haven't used that humidifier in a while, make sure that it's cleaned well before you turn it on in your child's room.
There is a lot of talk on natural remedies, and a lot of the natural remedies have not been proven to be more effective than a placebo or like a fake medication that helps. So those are your vitamin C and your zinc and echinacea. Some have side effects, but for the most part, they're safe to use, but actually not that effective. So not necessary to give. Honey, though, however, has been proven to help with cough. You don't want to give honey to a baby less than 1 due to the risk of botulism. But honey, like a half a teaspoon or a teaspoon, either straight from a spoon or mixed in like a warm tea, can really help soothe the throat and help with cough.
So when should I worry about my child if they have a cold?
So something to look for, especially with younger children, because a lot of times your viral URIs can lead to something more serious. So if your child develops hard breathing, faster breathing, or seems to be having trouble breathing, definitely should seek medical attention.
Yeah, it's what we call retractions, meaning if you can see your child's like skin sucking in between their ribs, or like under the ribs, or like above the collarbone.
That could be a sign of a more serious lower respiratory infection.
Yeah. If your child is having symptoms that are lasting longer than 10 days and seem to be getting worse and not better, they should be evaluated.
And also if your child's not adequately hydrated, they're not drinking with this illness, and you're concerned for dehydration, you should seek medical attention.
Yeah, and I mentioned it in previous episodes, but your best indicator of hydration is what's coming out. So watch those wet diapers. Make sure your child is making a wet diaper every 2 to 3 hours, and that your child is urinating.
So how can we prevent the transmission of this virus?
Yeah, so number one, most important thing is good hand washing. Washing your hands frequently. I even tell parents, like, in the wintertime, shopping carts, make sure most grocery stores now have those like sanitizer wipes to like clean the handle of the grocery cart.
And your child doesn't necessarily need to be excluded from school. By the time symptoms have shown in this virus, the exposure's already happened. So unless your child is, having a fever, or they're, copious coughing and runny nose, you don't necessarily need to keep them out of school.
And teaching your child to cover their mouth and nose if they sneeze or cough, or coughing into their sleeve, and then obviously good hand washing. Again,
hand washing, and
wash.
That's why they're saying doing the cough into the elbow now rather than into the hands.
Yeah.
So when do antibiotics come into play? The viral URI, or the cold, is one of the first symptoms to a leading more serious infection, like your sinus infections, your ear infections, or even sore throat or your strep throat infections.
Yeah, but again, I'm going to say it again. The common cold is a virus and doesn't necessarily need to be treated, shouldn't be treated with antibiotics unless your child develops one of these secondary illnesses. But as always, parents know their child best. If you're concerned about your child or your child's cold symptoms, make an appointment with your pediatrician.
That's, I think, everything for the letter N. And next week is the letter O, and we will be talking about obesity.
So as always, if you have anything to say, we'd love to hear from you. You can email us at kidsato@dmc.org. Give us a like, give us a share, give us a comment. See you then.
Thanks for watching.